Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of infectious medicine is acute bacterial meningitis. This section will be covered in 5 sections, and the first section will be the etiological factors of acute bacterial meningitis, and different etiological factors we will talk about in this section, including some gram-negative bacilli, and besides that some other causative agents, and then also the acute infections of the nervous system that can lead to acute bacterial meningitis. So all that will be discussed in the first section of our topic, which is acute bacterial meningitis. Then in the second section, we will talk about the pathophysiology, how the acute bacterial meningitis begin and progress, and what are some neurological manifestations of acute bacterial meningitis, how the induction of inflammatory response occur as a result of bacterial infection leading to meningitis, and what are some early stages of meningitis and how it progresses. Then in this third section, we will discuss some clinical presentations of acute bacterial meningitis, which will be included like seizures, increased intracranial pressure as a result of meningitis, and then increased intracranial pressure also have its presentation. So we will talk about that also. And then we will talk about the meningococcemia and the skin lesions associated with the meningococcemia. Then in the fourth section, we will talk about the diagnosis of acute bacterial meningitis in immunocompromised patients, patients who have low immunity, how the disease affects those individuals. And also we will talk about the glucose concentration of cerebrospinal fluid and the polymerase chain reaction. Then we will talk about the other tests like latex agglutination test and MRI abnormalities in patients with meningitis. And then in the fifth and final section, we will talk about the treatment and prognosis, how we treat the bacterial meningitis and what's the prognosis of bacterial meningitis, what's the cure rate of the bacterial meningitis. So we will talk about the treatment like specific treatment and also empirical treatment for acute bacterial meningitis. Then we will discuss the treatment of pneumococcal, listeria, and staphylococcal meningitis. And again, we will talk about the prognosis of all these different types of meningitis caused by pneumococci, meningococci, listeria, and staphylococcus. So different bacteria can cause the meningitis. So we will discuss one by one all the treatment options or treatments available for different types of bacteria leading to meningitis and what's the prognosis with each type of meningitis. So that will conclude our lecture of acute bacterial meningitis. So we will discuss it in detail. So keep watching sqadia.com to learn about our topic acute bacterial meningitis.